Hello, hello, hello. It is Thriving Thursday. I'm Dr. JeNeen Ridgway of Better Health Solutions. Gosh, it feels like it's been a minute. It has been a minute. I hope you all had a wonderful Thanksgiving. And we are just going to jump right in. Today's topic is one of my favorite topics to talk about. I am bringing some data today. If you're joining me on YouTube or maybe on Facebook, if Facebook cooperates, you'll see some slides, you'll see some graphics. I want to really show you what I'm talking about because, some of you might just think I'm just spurting off at the mouth or I'm just coming up with this stuff out of the side of my head. So I want to show you some things that are very, very important. The topic is your medicine cabinet hurting you or harming you? But in true Thriving Thursday fashion, before we get into that, we will be looking at a little personal development. It all starts with focused intense thought, the FIT in fitness. So today I'm reading from these little cards that I like here, and it says, read the word even when you don't feel like it. Feelings fade. God's truth doesn't. Read the word daily, even when motivation is missing. And then it proceeds to break down some of these words. And so one of the words, feelings. Emotions make bad leaders. I'm going to say that again. Emotions make bad leaders. Let truth lead instead. We have to do what we know, not what we feel. Fade. Your feelings will change. God's word stays steady. God's truth. His promises remain true whether you feel strong or weak. Daily. Scripture. Let's see. What does it say? Scriptures read in dry seasons still water future growth. Oh, yes, that's so true. And then motivation. Faithfulness often shows up before feelings do. I like that. So once again, feelings fade. God's truth doesn't. Read the word daily, even when motivation is missing. Okay. So that's today's little focus intense thought. So let's jump right in. And I like this topic because oftentimes you hear me talk about different formulas, different specific nutrition, different supplementation. And the reason why I do this is because I do truly care. I want to provide you with solutions that is going to keep you from going down a road that harms you. Okay? I mean, why not? If we have some great solutions with things that are natural, things that are not going to cause you any harm, why not try that first? And so that's why I'm always educating. Like, I really do share because I care. So let's jump right in. All right. So the main purpose of medicine cabinets. Why do people have these things around the house? Obviously, a lot of times people have pain relievers. That's one of the main things that we find in these medicine cabinets. People are trying to get out of pain, or they're trying to stop additional pain. They're trying to stop inflammation. You've got, these different cold medicines and things. And as soon as you feel something, you go and you start taking this medicine. But all of these pharmaceuticals have major and minor side effects. And so if you can handle this a different way, I highly recommend it. The problems with normal medicine cabinets. So 69% of drugs have between 10 and 100 different side effects. That is a lot. 22% of drugs have more than 100 different side effects. And oftentimes, whether it is prescribed or whether it's something over the counter that people perceive as safer, you end up taking one thing and then that's causing another thing. And then you add something on top of it to handle that. Doctors are notorious for this, especially now that we've got all of these micro specialties. I see that a lot of people are not being managed as a whole person, but they're being managed as this condition or that condition. And nobody's really looking at the person as a whole, putting all of this together and looking at, well, how is this affecting their system? And is this one medication causing these three other problems that we now have to add these medications? And so it's a huge problem. It says here, the study published in the Journal of the American Medical Association warns that depression is a potential side effect of more than 200 commonly prescribed medications. Think about it. How many people do you know? How many of your family members do you know that are on antidepressants? And are they on other medications too? You have to start thinking about these things and asking these types of questions. Oftentimes we are being prescribed medicines that can't really fix a nutritional deficiency. Oftentimes these problems stem from nutritional deficiencies. This is what I see, this is what I know, and this is what I've seen change just like that. By fixing the nutritional deficiencies, the body knows what to do and the body can then heal. So FitFam is something that I watch every single week. It's on YouTube. This is a link that you can get over to that page, but this is put on by the owners of OHS. And they had a specific episode on prescription drugs. So I want you to go there. I want you to search it and I want you to watch it because it's important. It's just going to kind of rubber stamp what I'm talking about today. The more you hear it, the more it'll get into your subconscious and the more it'll help you to make a different choice the next time it comes around. So go over to YouTube. If you're already on YouTube, when you get off of here, go find FitFam and subscribe to it. It's really good. Okay, so are you drug deficient? I don't think so. We were not created to be dependent on pharmaceuticals. They didn't even exist back then. The majority of disease and pain can be fixed and alleviated by lifestyle and therapeutic nutrients. I'm going to say that a few times, okay? Because this is the absolute truth. So let's talk about NSAIDs. Why do I want to talk about NSAIDs? Because of the Okay. I always have trouble on Facebook. Always, every single week. Um, I want to talk about NSAIDs because of the prevalence of their use and the fact that people think that if you can buy it in the grocery store, at the corner, drugstore, that it's safe. And that could not be further from the truth. And that's why I will say these things until I am blue in the face, okay? So hopefully you're listening and you get it, and I don't have to turn blue because I don't want to be blue. So, pain and injury, acute pain and inflammation. 4 out of 5 people, when asked, suffer from some form of pain or inflammation weekly. This is a huge number. This is like literally the majority of the population. Um, and it's crazy when you think about that, when you think about the fact that people are suffering at that level. It's shocking. And so, because there's so much suffering, people are trying to find ways around that, right? So today, the most common treatment for pain by most doctors, NSAIDs, right? Non-steroidal anti-inflammatory drugs. That's what that stands for. Most NSAIDs used, or the most used NSAIDs include aspirin. That one goes way back. Ibuprofen, naproxen, Celebrex, these kinds of things. You know who they are. You know the players. They're very, very common. But non-steroidal anti-inflammatory drugs are responsible for 30% of hospital admissions for adverse drug reactions. That's a huge number. So we're talking about all the medications out there, and there's a lot. This particular class is responsible for 30%, a whole third of hospital admissions. That's crazy. Mainly due to bleeding, heart attack, stroke, and renal damage. Do any of those things sound minor? And yet people take these things as if they're not harmful because they can just go buy them in the store. From the first day of use, the first day, not a month down the line, from the first day of use, all NSAIDs increase the risk of GI bleeding. That's like stomach, intestinal ulcers, that kind of thing. Myocardial infarction, heart attack, and stroke. NSAIDs affect the cardiovascular, the GI, the renal, which is your kidneys, and the respiratory system. I mean, did you know this, or did you think that it was just for pain? NSAIDs increase systolic blood pressure by 5 millimeters mercury and increase fluid retention. So how many people do you know that are on a blood pressure medication? And then they're also taking something over the counter for pain, not knowing that that's actually increasing their blood pressure. And then what happens? They go back to the doctor, the blood pressure is still high. And what does the doctor do? Adds on another drug. It's not uncommon for people to be on 2, 3, 4 blood pressure medications alone, in addition to all the other stuff, and taking NSAIDs. NSAID use in patients over the age of 65 more than doubles the risk of acute kidney injury in the next 30 days. These statistics are truly shocking. I don't know if they're as shocking to you as they are to me, but they are really, really, really shocking. This one here, NSAIDs can increase your risk of AFib up to 84%. What? That's almost doubling your risk. This is FDA findings. NSAIDs increase your risk of heart failure. That risk goes up quickly in the first week of taking them. It doesn't take a long time. Even occasional users are at risk, and patients given NSAIDs after a first heart attack were more likely to die within a year compared to those that didn't take them. Now, why don't we hear this? Well, is anybody going back to say, hey, in the last year, did you take Motrin? Did you take ibuprofen? No, they're not doing that. But it's right there in the literature. It's right there for the seeing. So, this is an Advil label, one of the common over the counter drugs. When you zoom in, it says stomach bleeding warning. It's right there on the package. This product contains a non-steroidal anti-inflammatory drug which may cause severe stomach bleeding. The chances are higher if you are over 60 and if you have stomach ulcers. How many people over 60 are taking NSAIDs every single day? Think about it, right? It is shocking. We can go on. You can do all of these searches, these Google searches, these AI searches. You can find this information easily, but it is a problem. Other problems with NSAIDs. 1 kilogram of aspirin causes kidney disease. 3,000 aspirins equal 1 kilogram. 3 aspirin a day for 3 years will add up to a kilogram. And oftentimes what happens is people start taking something, they hear, oh, you have to take this every day for this, that, or the other thing, and they just stay on it. And a lot of times you ask somebody why they're on a certain medication and they can't even tell you. Oh, yeah, I got on that 4 years ago. And it might be something that says right there on the label for short-term use. But they're put on it, never taken off. They never think any more about it. They just add it to the regimen. So these are the things that we have to be conscious of. We really have to think about it. 1988 study, 2 aspirin a day for 20 years caused a 57% increase in pancreatic cancer. Wow. Wow, wow, wow. This is another thing. The FDA has concluded that the data does not support the use of aspirin as a preventive medicine or cardiovascular medicine for people who have not had a heart attack, stroke, or cardiovascular problems, a use that they call primary prevention. So it's not even supported in the literature. All right. So you have to think about the cost benefit analysis. Does the benefit outweigh the risk? What about Tylenol? Ooh, Tylenol has gotten some press lately, hasn't it? And it hasn't been good. And it's not new to us in the natural healing fields, but I know some of you didn't know that Tylenol was dangerous, right? Tylenol, oh my gosh, let's talk about it. So Tylenol is actually the leading cause of liver failure. Did you know that? The leading number one cause of liver failure and liver transplant. Tylenol. The Tylenol that you can go right down to the corner and just pick up and purchase. It's also the most common cause of intentional and unintentional poisonings. You understand what intentional poisoning means, right? Yeah, yeah, it's not good. Despite years of misinformation on Tylenol and being told that Tylenol is safe in pregnancy, it increases a baby's risk of autism, ADHD, neurological disorders with that whole track, and reproductive disorders. Yep, yep. And one of the main ways that it does this is because it actually lowers your glutathione, which is your body's number one antioxidant, and it helps you to detoxify. So if you can't detoxify toxins that are coming into your body, those toxins have the ability to wreak havoc and cause more problems than they would have if you hadn't shut down those pathways with said drug. Very, very important. So Tylenol depletes glutathione. Just said that. So that prevents it basically prevents our body from being able to repair, prevents our body from being able to detoxify. It messes with the immune function and it causes us to take a lot longer to heal, than we normally would. Unlike other antioxidants, glutathione prevents oxidative damage in the brain. Low glutathione equals the onset of brain damage. This stuff is shocking. It's very, very shocking. Prescription acetaminophen products to be limited to 325 milligrams per dose. Boxed warning will highlight potential of severe liver failure. Boxed warnings are basically the highest level of warning that there is, and they're put on drugs that have basically the potential to create major, major harm, including what they call fatal events. Um, Nobody knows this about Tylenol. This is why I'm here. This is why I'm sharing. It's important. Okay, so let the label be your education. Let the label be your education. I wanna jump over here to my iPad and show you something. Okay, let's see here. So I'm going to go over to my iPad. This is what I teach my patients to do when they're on medications, whether it be prescribed or over the counter. Go to a website. It's called drugs.com. Very easy, drugs.com. You can put in any medication. They have the generics as well as the name brands. This is on ibuprofen, for instance. It tells you what it is, what it does, and then you have the warnings. So I want you to know this is not just me talking. Warnings. Ibuprofen can increase your risk of fatal heart attack or stroke. Do not use this medication just before or after heart bypass surgery. Oh my God. Ibuprofen may also cause stomach and intestinal bleeding, which can be fatal. It literally says fatality in the first two lines. These conditions can occur without warning while you're using this medication, especially in older adults. Do not take more than the recommended dose, blah, 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 etc. It's the second thing on the list. So going on down, talks about before you take this medication. Now, is anybody standing in the store reading the label saying, have I had a heart attack? Have I had stomach ulcers or bleeding? Have I ever had liver or kidney disease? You know how many Americans have liver disease, non-alcoholic fatty liver disease from processed foods and ultra processed foods, asthma? I mean, did you know that you shouldn't be taking an ibuprofen if you have asthma? No, people don't know this. And how many people have kidney disease because of their high blood pressure medications? And yeah, I said because of their medications. In most cases, it's the medicine that actually causes the kidney disease. So yeah, that's one website that you can go to. I want to pull up another label. This is just near and dear to my heart. The reason why I share so often is because it's my hope that I can get to the youth before they get hooked on this stuff. This is a label for Midol. Midol is sold for menstrual pain relief. And if we zoom in here, liver warning. This product contains acetaminophen. Severe liver damage may occur. Young girls are taking this. Young girls are taking this. They're taking it for cramps, bloating, water weight gain, headache, backache, muscle aches, and fatigue. And what they're getting in return is possible liver damage, potential liver failure. So that's why I'm so passionate about sharing and doing what I'm doing right now. All right, let me get back to the PDF. So finally, some good news. There is a safer anti-inflammatory, and is the natural NSAID pack. And the natural NSAID pack is a true game changer. This is an all natural, plant based, whole food supplement. It's got all of the nutrients that your body actually needs to deal with inflammation, to calm that down, to deal with the pain without any of those negative side effects and risk. Absolute necessity when patients are taking NSAIDs to combat pain and inflammation. This is an absolute necessity to have in the house. This is one of those things that I consider a medicine cabinet product. You should have it in your house at all times because you may be taking it, on a daily basis for chronic underlying inflammation. But if you have any kind of acute situation, injury, or something like that, you need it right then. You need it right then. You never know when you're going to have, cramps or aches or pains, and you need this. Okay, so what's in here? Well, first of all, what does it do? Aids the body in reducing inflammation. Inflammation is the underlying root cause of all the chronic and degenerative diseases. Helps repair tissue, combats disc degeneration in your back. So many Americans have chronic low back pain. This actually helps with that. Promotes cartilage health, cartilage regrowth, bone development. And it's just such a better, safer option than all of those things that I talked about. Okay. So I cannot stress enough how important it is to have this. Another thing that I want to stress is that a lot of times you may just need one just if you've had some, you have some inflammation or you want to keep it in check, this has all of the plant phytonutrients, a lot of the things that you don't get because we don't eat a lot of variety of our fruits and vegetables. But what I want to stress is that if you have an acute issue, if you've just injured yourself, if you've had surgery, if you have a cut, a scrape, a fall, something like that, if you're having, I use these when I was having a major allergic reaction. Um, but whenever you're having something acute, you need to take more than one a day. You need to take more than one. Don't be afraid to dose the products out properly. You've got to have a steady stream of these nutrients in your system. So it's okay. It's just nutrients. It's like food in a capsule. You can't overdose. So it's okay if you need 3 or 4 a day in an acute situation. That's perfectly okay. You just might need 2 boxes, but at least have 1 box. That way you can order another one and have it on the way. So we know based on those statistics, every person takes something for pain along the way. It's just something that is important to have. Now, in addition to pain, inflammation can also be, fluid. And sometimes people are putting on weight, they're holding more fluids because their body is more toxic. They need the nutrients to help get rid of that. And this helps a lot with that. Really, really helps a lot with that. So I highly recommend it. Again, it's something that I have here all of the time. Every single time it gets low, I'm like, okay, I gotta get me some more natural NSAID packs. The other thing that I'll do, what's actually in here is EFA, essential fatty acids, joint nutrients. That's like the glucosamine conjointin that helps to rebuild the joints, the knees, shoulders, things like that. Phytonutrients, there's 3 capsules of Protect in here, if you know Protect by name. 3 capsules of it in every single packet. It's a very potent anti-inflammatory from the nutrient standpoint. And then you have the protease anti-inflammatories, which is like the enzymes. So you're breaking down inflammation with the enzymes. And then you also have your turmeric and your luteolin and your sulforaphane and ginger and lycopene and lutein and all of these things, zeaxanthin, I mean, curcumin. I could just go on and on. A lot of good stuff. So it's a very, very good bang for the buck. And that's about all I have to say for it. If you don't get it, I don't know what to tell you, but you saw the statistics, you saw the danger, you know there's a better way. So now that you know better, just do better, okay? Um, I've got my link there on the screen that goes to my link tree. All the things that I love are there. All the things that I talk about. There's a link to my Optimal Health System store. That's where these can be found. And I can't think of how much it is off the top of my head, but it's a really, really good value because 1 bottle of Protect is like $48 and you're getting a bottle and a half. And it's like, I don't know, 80 something, I think. So anyway, that's all I have to say about that. And I hope you all have a wonderful rest of your day. I'm so happy that I am back on Thriving Thursday, and I'm going to continue to get all the technical glitches worked out. But please subscribe to the channel and please share these out. I just want people to have this information. And even if you don't buy anything, those nutrients I just listed, you can add those to your diet. They'll make a huge difference. And just be cognizant of these NSAIDs that you're putting in your body. Know what you're putting in your body and know what the risks are. Okay? Love you all and have a great rest of your day. And I will see you not next week. Not next week. I'll see you in 2 weeks, unless I find some other time to do this. All right. Have a great day, everybody. Bye bye.